The drug dealer and the doctor are writing the same prescription, different handwriting, different zip codes, same molecule. Most people assume there's a clean line between medicine and narcotics, legal versus illegal, safe versus dangerous, healing versus destroying. But that line doesn't exist in chemistry. It exists in paperwork. Here's what your pharmacy isn't advertising: Adderall and methamphetamine. Adderall is amphetamine. Methamphetamine is methamphetamine. They are not the same molecule, but they are close enough that your brain barely notices the difference. Both flood your brain with dopamine. Both sharpen focus, suppress appetite, and spike your heart rate. Both are Schedule II controlled substances. Disoxin, pharmaceutical methamphetamine, is legally prescribed in the United States for ADHD, for obesity, sold in white pills at licensed pharmacies. Your doctor can legally prescribe you methamphetamine. Most of them just don't. Ketamine. For decades, ketamine was a party drug, snorted at clubs, associated with blackouts, seized at borders. In 2019, the FDA approved esketamine as an antidepressant, brand name Spravato, nasal spray, supervised clinical sessions. The mechanism is identical to what recreational users experience: NMDA receptor blockade, dissociation, reality softening at the edges. Now psychiatrists call it therapeutic. The drug didn't change, the context did. Opioids, OxyContin, Vitagen, fentanyl patches, morphine drips. They attach to the same receptors as heroin, produce the same warmth, the same heavy calm, the same shutdown of pain signals. Heroin itself was originally a pharmaceutical. Bayer, the aspirin company, synthesized it in 1898 and marketed it as a non-addictive cough suppressant. That was the pitch: non-addictive. The opioid crisis followed the same script decades later. Purdue Pharma marketed OxyContin as having low addiction potential. Prescriptions surged. Dependency followed. When prescriptions dried up, some patients moved to street heroin, cheaper, easier to find. The chemistry was never the problem. The information around it was. Benzodiazepines and GHB, Valium, Xanax, Klonopin, prescribed daily for anxiety and insomnia. They enhance GABA, the brain chemical that slows activity and produces calm. GHB does something nearly identical. It's Schedule I, officially no accepted medical use. Except Xyrem, the pharmaceutical version of GHB, is FDA approved for narcolepsy. One of the most tightly controlled prescriptions in the country, but it exists. Withdrawal from benzodiazepines can cause fatal seizures. So can GHB withdrawal. The pharmacology of dangerous withdrawal does not care which version of calm you chose. Cocaine. Cocaine is still used in medicine. Ear, nose, and throat surgeons use it as a topical anesthetic during nasal procedures. It numbs tissue and constricts blood vessels simultaneously, a combination no synthetic drug fully replicates. It is in operating rooms right now. The drug that defines an era of prohibition is quietly applied to nasal passages in surgical suites every week. Psilocybin. Schedule I. Officially, no accepted medical use, high abuse potential, unsafe even under supervision. Johns Hopkins, NYU, and Imperial College London have published peer-reviewed data showing significant results for treatment-resistant depression and end-of-life anxiety. The FDA granted it Breakthrough Therapy designation. That's the label for drugs showing substantial improvement over existing treatments. Schedule I means no medical use. Breakthrough therapy means exactly the opposite. Both are simultaneously true depending on which government document you're reading. MDMA, ecstasy, Molly, a club drug associated with raves and bad decisions. Currently in Phase 3 FDA clinical trials for PTSD treatment. Combat veterans, sexual assault survivors, patients reporting reductions in symptoms that years of therapy couldn't reach. The same chemical that gets people arrested at music festivals is being administered in therapists' offices to treat trauma. Morphine and heroin. Morphine is prescribed in hospitals globally every day. It's the gold standard for severe pain management after surgery, in cancer treatment, and end-of-life care. Heroin, diacetylmorphine, is morphine with two acetyl groups attached. The body converts heroin back into morphine almost immediately after it enters the bloodstream. You are, chemically, receiving morphine either way. The legal version just takes one extra step to get there. In the United Kingdom, heroin is a legally prescribed painkiller, brand name diamorphine, used in hospitals for severe pain and as a maintenance drug for opioid addiction. The same molecule that carries a life sentence in some US states is administered by nurses in British hospitals every morning. Amphetamines and combat. Adderall is prescribed to millions of children and adults for ADHD. The active ingredient is amphetamine. During World War II, amphetamines were issued to soldiers by multiple governments, American, British, German, Japanese, to reduce fatigue, increase aggression, and keep troops awake for extended operations. The German military issued methamphetamine under the brand name Pervitin. Soldiers called it tank chocolate. The same class of drug being prescribed to school children for focus was being distributed to soldiers to make them capable of killing for longer. The molecule has no memory of what it was used for last. What this means: the molecules are not moral. Chemistry doesn't know if it's being prescribed. It doesn't know if the person holding it has insurance or a corner. It activates receptors. It produces effects. It exits the body on a timeline. What changes is who gets access, at what dose, with what information, and what happens to them legally if they're caught without the right paperwork. People serving prison sentences for possession of substances that, reformulated and rebranded, are available at pharmacies 2 miles away. This isn't an argument for or against any drug. It's a description of the gap between what chemistry is and what policy says it is. The line between medicine and narcotic has never been drawn by science. It's been drawn by history, economics, and whoever was in the room when the legislation was written. The molecule doesn't know which side of the line it landed on.